father, he was suffering from dialysis, from kidney failure, and he was undergoing continuous dialysis. But he was, weakening over time. And as a family, we took a decision that he did not want further treatment. So he wanted to avoid going to the hospital towards the end of his days, and we were very concerned about whether we would be able to
take care of comfortable life,
because he was very insistent on being at home. So we asked several of our doctor friends, and we actually met with 3 or 4 different nursing services. But when we met with, when I spoke to Sister Baby and IHC, I felt that the questions that were being asked and the empathy that was demonstrated even in the early conversations, we felt that this was our best option in terms of someone who would understand the not just the needs of the patients, but also take care of them as a human being rather than as just another,
having more compassion.
Yeah, with a lot of compassion. So that's the reason why we
operate for this company.
Yeah.
India Health, right?
India Healthcare, yeah.
Healthcare.
Actually, initially when the first nurse that they sent, he was very competent, but we were a bit concerned about his attitude. Just the first day itself, because he was talking a lot and my father wanted quiet, and he was not comfortable. But I was very impressed because when I called up the office and gave this feedback, just within 24 hours they sent another staff. And they said, don't worry about anything, and they sent other staff, and they personally came. I think the supervisors came, and they supervised for 2 full days, and they asked us if there was anything else that we were concerned about. So I was very
comforted by they are checking the whole body with anything needed for the comfortable too, because he's always lying down.
Yeah. And not only that, obviously there was a set of instructions from the doctors, but we found that some of the nurses who were taking care of him, they went really out of the way to maintain the cleanliness, to ensure that he was comfortable 24/7. Whenever he wanted company, they would make sure that they were talking to him. So we felt that they were taking care of him as a relative and a loved one rather than a patient. So that was very nice. We would definitely recommend. In fact, I think both my mother and I, whenever other relatives and friends have asked us.
We did recommend it, but that did not suit, in fact.
Yes, one of my aunts also. But
suffering from cancer. We wanted palatal.
Actually, that was a very nice aspect. We recommended your company to my uncle for my aunt's palliative care. And I think your company themselves said that this is not the right option, and they recommended something else. So that was nice, that rather than you just grabbing the business, you recommended what was better for the family and the patient. So that was very nice. We would definitely recommend, and I think we in fact, before the illness lasted for almost 3 years, we have tried other nursing services before. I think the biggest differences was that you were really listening. And the patient's comfort came above all things, and there was no, talk of any, the cost of changing the nurse or, I think initially
we asked peace. We were in very peace.
Yeah.
One staff came here.
Yeah. I think initially we asked for 12 hours, and then when we asked for 24/7, it was immediate response. So I think at that time when you are trying to focus on the relative, and you are trying to deal with so many things, it's a real godsend to have a nursing service that I think shows a lot of empathy and compassion, and doesn't it stopped being another thing that we had to deal with. We were able to take that for granted. That was a huge godsend for us at that time.
At the end also they gave very good